Good morning, nursing officer. Today I came with a 15 important questions which are asked so many times in many entrance exam. So let's start our today's question session with a beautiful quote. I can accept failure. Everyone fails at something, but I can't accept not trying. So trying and trying until you get your succeed. You should also solve this question with me so you get better evaluating yourself. So let's begin our today's journey. Our first question is, in a two rescuer CPR, the rescuer changed their position after. Our right answer is 5 cycle. The next question, a restless patient is restraining a nurse is released restraint in every. Our correct answer is 2 hours. So right answer is 2 hours. Nurse should release the restraint every 2 hours. Then third question, a patient come in emergency department with a severe pelvic injury. Which of the following is a contraindicated in this patient? Our right answer is urinary catheterization. Because in a severe pelvic injury, there is also chances of bladder injury. So before evaluating the bladder system or urinary system, we should not try for urinary catheterization. The fourth question, a patient is on acetaminophen therapy. Which of the following should nurse observe in this patient? Our right answer is serum transaminase, because acetaminophen causes liver damage. So we have to evaluate the serum transaminase value. The fifth question, a patient is a fall down in a floor. What should the nurse check first? Our right answer is unresponsiveness. Nurse should first check the responsiveness of the patient. Then the sixth question, incubation period of tapeworm is. So our right answer is 10 to 12 weeks. So normal incubation period of a tapeworm is a 10 to 14 weeks. So here according to this, our right answer is a C, 10 to 12 weeks. The seventh question, Anganwadi workers supervised by. Our right answer is Mukhya Sevika. Every 40 to 65 Anganwadi workers are supervised by one Mukhya Sevika. The seventh question, a patient is received 3000 ml IV fluid to be administered in a 24 hours. If a drop factor is a 10 drop per minute, then identify the flow rate. So let's calculate it. We know the formula. The flow rate is equal to volume in a ml into drop factor divided by a time in minute. When we put this number in a formula, we get the answer of 21 drop per minute. So here is a calculation. Volume is a 3000, drop factor is a 10 and time is in minute. So 24 into 60. So we get the answer of 20.83. It is around 21 drops per minute. Then eighth question, bluish discoloration of a cervix in a pregnancy is called as. So our right answer is a Jacquet sign. It is also called Jacquemus sign. So Goodell sign, it is a softening of vaginal portion of a cervix from increase the vascularization which present at approximately 4 weeks. Then Hagar sign, it is a softening of a uterine isthmus resulting in a incompressibility on a bimanual examination which observed around 6 to 8 weeks. Then Braxton contraction, it is a contraction felt by mother around the second trimester. Okay. The next question, all of the sign of preeclampsia except. We know that the sign of preeclampsia are hypertension, edema and proteinuria. So here our right answer is fever. Fever is not a sign of preeclampsia. The next question, which statement is right about contraceptive pill Chaya except? So here our right answer is not safe in breastfeeding mother, because Chaya is a safe during a breastfeeding mother. So it is a right answer here. So Chaya is the non-hormonal, non-steroidal once a week contraceptive pills. So Chaya, it is also called as a Centromian, is a non-hormonal pills that needs to be take twice a week for a first 3 months and then once a week thereafter. It is a safe and effective method during a breastfeeding mother. So here is a Chaya, which is a non-steroidal, non-hormonal pills. Okay. The next question, which antipsychotic drug may cause amenorrhea? So here our right answer is a risperidol, because risperidol is increase the prolactin level, so it may leads to a amenorrhea in a woman. The following is the early sign of increased ICP in a child. Here our right answer is a bulging fontanelle. The next question, which of the following program is related to immunization? Here our right answer is Indradhanush, Mission Indradhanush. So this program launched in 25 December 2014 by JP Nada, a Union Health Minister. The goal of this program is to coverage of India's child in a year of 2020. It includes the 7 vaccines. So it is called Indradhanush. The vaccine included in a Mission Indradhanush are diphtheria, pertussis, tetanus, tuberculosis, polio, hepatitis B and measles. The next question, according to WHO, which is not included in a surgical safety checklist in a OT? So our right answer is a sign out. So sign in before induction of anesthesia, time out before skin incision, and sign out is before patient leave the operating room. So sorry, here our right answer is time in. Time in is not included in a WHO surgical safety checklist. The next question, which solution is used to prevent a clotting in a intravenous cannula before a blood transfusion? So right answer is a normal saline. We give normal saline to prevent the clotting. The next question, a female patient arrived in a hospital with abdominal pain after pelvic trauma. All vitals are normal and a patient have amenorrhea from last 2 months. What is the next investigation? So here our right answer is a urine pregnancy test. We have to evaluate the UPT test because the patient having a 2 months of amenorrhea. Next question, which vaccine is contraindicated in a pregnancy except? So here we know that all live vaccines are contraindicated in a pregnancy except the yellow fever. So here rubella, measles and rotavirus is a live vaccine. So our right answer is a diphtheria. Diphtheria is come under the toxoid. The next question, erection development stage in a toddler child. So toddler child have a stage of autonomy versus shame and doubt. Trust versus mistrust is come in a infant. Initiative versus guilt, it is for a school going children 5 to 12 year, and identity versus role confusion is shown in adolescents 12 to 18 year of age. The next question, bitter spot and xerophthalmia is due to the deficiency of. So our right answer is vitamin A. Vitamin A deficiency cause xerophthalmia, night blindness and bitter spot. Vitamin C deficiency caused scurvy. Question, in a HIV positive patient, Montauk's tuberculin test is positive when the scar is more than. So here our right answer is 5 mm. So in a normal patient, if a duration is about more than 10 mm, then we get a positive result. But in a HIV positive patient, the in duration of scar is about more than 5 mm. Then classical sign of pyloric stenosis in a child, we all know that is a projectile vomiting. The next question, a patient is in a severe dyspnea. Which of the following position nurse give the patient? So Fowler position is the best for a severe dyspnea. Which of position will you give in a lumbar puncture procedure? So right answer is the C-shaped position. We should provide a C-shaped position while lumbar puncture procedure. Then incubation period of tetanus is, so our right answer is a 10 day. Incubation period of tetanus is about 10 days. The incubation is around 3 to 21 days, so it is average about 10 days. Then the question number 25, a patient who has a hyperkalemia, which of the following changes in a ECG seen? So in a hyperkalemia patient, in ECG have a tall peak T wave. So our right answer is a B. The next question, in a DPT vaccine, P stand for, we know that the D means diphtheria, P means pertussis, and T for tetanus. So our right answer is a whooping cough, because pertussis is also known as a whooping cough. Then question number 27, a patient in a ICU needs urgent CPR. Which of the following code is used to call an emergency CPR team? Our right answer is a code blue. So code red is for a fire, code black it is for a bomb threat, and code pink is for a child abduction, any missing child from the ward. The next question, which of the following is a mix in a small amount with a ABG blood sample syringe? Our right answer is the heparin, because heparin is an anticoagulant which prevent the blood clot in a syringe. Then 29th question, a woman comes to the hospital. His history is a one abortion 2 years back, one twin baby, and now she is pregnant. What is a GTPL score? So here G for gravida, T for term pregnancy, P for a preterm pregnancy, A for a abortion, and L for a live birth. So here woman, it is pregnant now, so gravida 1, and before current pregnancy she pregnant 2 times. So here the gravida is a 3, G3. Then T, term pregnancy is a 1. Then preterm, so woman have a 1 abortion 2 years back, so preterm is a 1, and abortion is also 1, and live birth is a 2. So our right answer is A, G3, T1, P1, A1, and L2. The next question, in a newborn baby, white cheesy layer over the skin is called. Our right answer is a vernix caseosa. So milia are tiny white bumps on a baby's nose, chin, or cheeks. Okay. Then question number 31, catgut suture is a which type of suture? So our right answer is it is a natural absorbable suture. So answer B is a right. Catgut suture is a natural absorbable suture. Then question number 32. Which of the following questionnaire is used in alcoholism? So here our right answer is B, CAGE. We use the CAGE questionnaire in a patient have a alcoholism. So C for a cut down, A for annoyed by people, criticizing by people, then G for a guilty about your drinking, and E for eye opening, means have you ever had a drink first thing in the morning. So this type of question asked in a patient have alcoholism. Then question number 33, for assessment of a malnutrition in a children based on, so our right answer is weight for age is a best criteria for assessment of a malnutrition in a children. Okay. Then question number 34, a patient has a renal transplantation 24 hours before. The nurse should understand that a warning sign after renal transplantation is. So here our right answer is a fever with chills. So a fever is the first sign of a graft rejection. Okay. Then question number 35, which of the following solution is recommended by WHO after blood spillage in a hospital? So here our right answer is sodium hypochlorite. The next question number 36, which of the following is the first sign in a patient whose immune system is suppressed? So here our right answer is fever. Fever is the first sign for an immunocompromised patient. Then question number 37, before giving a ECT, electroconvulsive therapy to the patient, an anesthetic gives pethidine following a succinyl chloride. What is the purpose? So here pethidine is also used as an anesthesia in a ECT. Then next question, which of the following route is correct to give a Mantoux test PPD, pure protein derivative in a patient? So here our right answer is intradermal. PPD should use as an intradermal route. The next question, a maximum duration of checking a pulse rate is last. So we have to check the pulse last about 10 seconds. The next question, effect of vagus stimulation on heart is, the right answer is it decreases the heart rate. Vagus stimulation causes bradycardia. The next question, the current method is used in CPR. So it is a CAB, CAB, C for circulation, A for airway and B for breathing. So we use this sequence in CPR method. Then question number 42. During the CPR, rescuer give breath to the patient after each. So our right answer is 6 to 8 seconds. Give one breath every 6 seconds, 10 breaths per minute. The next question, all of the following are a benefit of kangaroo mother except. So here our right answer is minimize PPH. Kangaroo mother cannot help in minimize PPH. Kangaroo mother can help in strong child-mother bond, increase the lactation and useful in a hypothermia. Then question number 44. Which of the following is the most useful position after each neurosurgery operation? So our best answer is supine. Supine position is the best after the neurosurgery operation because Trendelenburg position head and elevated is increase the intracranial pressure. Okay, so our best answer is the supine position. The next question, all of the following are an emergency contraceptive method except. So here our right answer is the diaphragm. Diaphragm cannot use as a emergency contraceptive method. The next question, drug of choice for a status epilepticus. So our right answer is the diazepam is a drug of choice for a status epilepticus. The next question, minimum distance between two insulin dose. So here our right answer is 4.5 millimeter. So the distance between a two insulin site not less than 3 millimeter and it is a maximum about 5 millimeter. So here our best answer is 4.5 millimeter. The question number 48, pain, blister, redness and infection seen in which stage of burn? So we know that blister seen in a second degree of burn. The next question, so it is the image based question. In the below image, the condition is caused by, so here you can see the exophthalmos. Okay, so it is seen in hyperthyroidism condition. So right answer is a A. The next question, the condition in the below image is caused by. Okay, so here you can see two signs. This one first image is a troistic sign and second one is a Tosus sign. So these two signs present in a hypocalcemia patient. So here we finish the 50 most important questions. So if you solve with me, then put your answer or put your marks in a comment box. Okay.